Welcome to my channel. Today I will be talking about complex regional pain syndrome and what it is. What is CRPS? And just an FYI, CRPS is a short abbreviation for complex regional pain syndrome. CRPS is a form of chronic pain that usually affects a leg or an arm. It is known as pain on the body. The pain for CRPS is out of proportion. Many patients describe this as an intolerable pain that they wish they have never experienced. There's no test that can specifically diagnose CRPS. For example, whenever you get tested for strep throat, the results of the test is positive or negative. It tells you you have it, you don't. Sadly, for this condition, there's no test that can diagnose the CRPS condition. Although the diagnosis is given after a physical exam and taking your medical history. If any of these are mentioned while taking your medical history, for example, if you mention showing symptoms after an injury, after a fracture or sprain, and even a damage to a specific nerve, those are key factors that can help with the conclusion of the diagnosis of this condition. There's a variety of symptoms. When it comes to this CRPS condition, there's many symptoms. There's intense burning pain that, of course, worsens over time and may spread to other parts of the body. There's swelling, stiffness, and even temperature changes in the affected leg or arm. There's skin changes such as redness, mottling, and shiny skin that also may appear. This CRPS is categorized in three stages: stage one, stage two, stage three. Very simple to understand. The first stage lasts about for 1 to 3 months, and the symptoms are barely starting to show. Stage two, symptoms are progressing more. There's more redness, more pain, body ache, and less range of motion. It lasts about 3 to 6 months. Stage three is the worst stage. If CRPS is obviously not taken care of in the previous two stages, this stage is a permanent stage. There's sadly no going back, and you will have to live with this for the rest of your life. There's an interesting fact about CRPS that in many cases the patient's feet may go inward due to the stiffness and the tightness of the muscles. Most of these patients do end up in a wheelchair, which is sad because it decreases the range of motion. It decreases how many stuff they can do throughout the day. It decreases so much stuff that these, brilliant people can do, but due to this CRPS condition and being stuck in a wheelchair, they're not able to. There's a variety of treatments. The most known are physical therapy, medications, and nerve blocks. There's medical prescriptions that can help manage the pain that CRPS causes. There's pain relievers, anti-inflammatory drugs, and antidepressants because many patients do end up in depression. Physical therapy helps reduce the pain, it improves the range of motion, and prevents muscle wasting. Nerve blocks is the rarest one, is injecting an anesthetic to the affected limb or part of the body. Um, it's risky, but of course, it does work with a certain, procedure. What's it like living with complex regional pain syndrome? These are just a few quotes that have been said. Going outside and feeling the wind on my shin feels like I'm being kicked over and over again. Washing my leg with the washcloth feels like sandpaper, even if it's the softest thing ever. I will probably never be pain free again, but my hope is that I can get out of this wheelchair one day. Even I, just reading these quotes, I have imagined how hard living with CRPS is, and I do not wish this on anybody. And thank you for watching, and just stay tuned for my next video.